Thanks for tuning in to Sleep Better TV. I'm Scott Drake. We continue our discussion with Dr. Blake Perkins of Dental Sleep Medicine in Vancouver, Washington. We are talking about the treatment of sleep breathing disorders. There are a lot of sleep breathing disorders. I mean, obstructive sleep apnea is not the only one. Can you talk about the different versions?
You bet. From the most simple, which is called UARS, or upper airway resistance syndrome, which is akin to having your airway not be as wide as it normally should be, and it's often accompanied by snoring. The next would be obstructive sleep apnea, which is a complete blockage of your airway and an inability to breathe while you're asleep. There's also central apneas, which is actually a neurological problem where your brain doesn't tell your diaphragm the correct message it needs in order to breathe. And then there's mixed apnea, which can be a combination of any one of those.
And what are the treatment options?
Well, if it's upper airway resistance syndrome, generally we work together with an ear, nose, and throat physician or an ENT. And a lot of times they can do different procedures to open up the airway, to make the back of the throat larger, basically. Or we can also use a mandibular advancement device, which will bring the tongue forward and open up the airway as well. Sometimes we do one or the other, or often a combination of both.
So I'm sure many people have seen the over-the-counter appliances on television or even at the drugstore. Are they any good?
Some pretty significant differences. I would say the main one is that the over-the-counter appliances aren't necessarily fit accurately to the patient's mouth. And that can induce all sorts of problems, from pain to problems with their gums, as well as not having a dentist follow a patient who has one of these appliances. Then you risk developing over time problems with your bite, because if you can imagine your lower jaw being forward for 6 to 8 hours while you're asleep, it does induce some changes, temporary changes in the muscles and in the temporomandibular joint, or the TMJ, as most people are familiar with. And if that's not very carefully watched and followed, there can be some long-lasting consequences to the patient's bite and to their joint.
Dr. Perkins, again, thank you so much.
You're welcome.
My guest has been Dr. Blake Perkins with Dental Sleep Medicine of Vancouver, Washington. This is Sleep Better TV. Thanks for watching.